Hi, I'm Dr. Eric Goulder, a preventive cardiologist, and I'm here today to give you some very important information that can not only impact your overall health, but also your life. Your dentist is making available to you a simple and very informative scan that gives us the ability to look inside your arteries and see what's going on. How healthy are they? This scan is called a CIMT. It's a simple ultrasound scan which actually allows us to see what's going on with the lining of your blood vessels. It's very different from the scan done at every hospital in this country, as well as those mobile scanning services. Those scans are called Doppler scans, and they're looking at the flow of blood through the artery. This CIMT scan, on the other hand, is looking at the lining of the arteries, looking for signs of early asymptomatic artery disease, changes to the lining of the blood vessel that can occur so early that has no effect on the blood flow. So there's only a few places in your body where we can actually see the arteries. Okay, we use the carotid artery in your neck because it's right under the skin. It's a big blood vessels. It's easy to access. This test requires no preparation on your part. There's no need to disrobe. There's no needles. There's no pain because it's using ultrasound, and it only takes about 15 minutes to perform. So you have about 30,000 miles of arteries in your body, which act just like the highways that we all drive over every day. And just like the highways that we drive on, the more traffic that goes over them, the more wear and tear they get. They can get potholes. And if these potholes aren't repaired, they can get deep enough that they can actually stop the flow of traffic, just like on poor Route 66 here. The same thing happens with artery disease. Our arteries are necessary to deliver oxygen and nutrients to every cell in our body, from our brain to our internal organs, our skeletal muscles, even the heart muscle. And just like a highway, they can develop signs of wear and tear. In our arteries, those signs of wear and tear are by thickening the lining of the blood vessel early on, and then they can actually develop what's called a plaque, which is like a bulging out of the lining into the channel where the blood flow goes. And this is just like a pimple, and just like a pimple that we all got when we were teenagers, it can get inflamed and infected and can burst. And when this plaque bursts, your body is going to try and repair it with a scab, just like when a pimple burst. Although in the arteries, this clot, we call it a clot, can actually grow to be big enough to totally obstruct the flow of blood through the artery. If this clot occurs in your heart, we call it a heart attack, and it involves the death of part of your heart muscle. If this clot occurs in your brain, we call it a stroke, and it results in a death of a portion of your brain. The good news is this simple scan can tell us how your highways are doing. Are they healthy, like this carotid artery right here, allowing unimpeded flow of blood everywhere in the body? Or are they developing signs of wear and tear, thickening the lining, or perhaps that plaque like this is right here, which can obstruct the flow of traffic or your blood through the arteries? Well, this simple scan only takes about 15 minutes to do. It gives us invaluable information about the health of your arteries so that we can come up with a plan to protect you from that heart attack or stroke. In fact, we can make you bulletproof to ever having a heart attack or stroke. So who should get this scan done? Well, as a preventive cardiologist, I feel that everybody over the age of 40 should have a scan for a baseline to know what's going on with their arteries. Arterial disease is the leading cause of death in our country. So it's important to find out before we get advanced disease if we have disease developing or not. And then certainly if you have a family history, a parent, a brother, a sister, a grandparent who's had a heart attack or a stroke, bypass or stent, you should get this scan done. And then if you have high blood pressure or high cholesterol or diabetes, you should definitely get this scan done. So that just leaves one question. How soon do you want to start?